Hi, I'm Harriet Vogt and I'm a Strategic Community Ambassador. It's a kind of natural extension of my day job. I'm a qualitative researcher and I do a lot of work in healthcare. And what that really means is I spend a lot of time listening to patients and their families and carers and healthcare professionals about their experiences and their needs. And then I apply that insight to developing strategies for communication, service development, product development. There are a lot of groups whose voices need amplification. You know, there's the homeless, there's people with physical disabilities, there's people with learning disabilities, and there's the isolated elderly. I mean, there's loads of senior citizens down here having a great life and who are far more digitally sophisticated than I ever will be. But there's also some isolated elderly folk. And we've got a population down here in Sussex which is biased older compared to the rest of the UK. And that means, of course, that there are more health problems, which happens as we get older. And that's why that's a group that we need to listen to very carefully. There's a huge range of programmes that you can get involved in, just depending upon what you're interested in and how much time that you can spare, which is also important. One of the most compelling programmes for me has been what they call the transformation projects of ophthalmology and cardiology in East Sussex. And that basically means making services better for everybody. And on those projects, I've worked as part of a steering group with senior management, clinical leads, quality leads, patient representatives, independent representatives like Health Watch, voluntary patient groups, patients themselves, communications teams, and the all-important public involvement team, which are the people that you spend a lot of time working with as a community ambassador. If you go to accident and emergency with a heart problem at the moment, what will happen is you'll go in and you'll be seen by a generalist, you'll be seen by an emergency medicine doctor. And unless you've got some desperate emergency that needs immediate attention, and there's actually very few people who are in that state, then you'll probably be referred to maybe a specialist appointment, back to your GP, waiting lists will intervene, and this could be quite a lengthy process. Working together as a team, we've co-produced a very different picture, a very different experience for patients and people delivering services. And one of the key differences is what they call front door services in both our major general hospitals. So if you have a heart problem and you go into A&E, you will go straight to a cardiac specialist. That specialist or specialist team will be able to give you evaluative tests there and then. They will be able to develop a pathway for you, almost certainly on the spot. No more waiting lists and bouncing around between primary care, general practice and specialists. It's quite likely that instead of, for example, a common pathway now, 28 weeks of waiting to get everything done that you need, you could be sorted out in 24 hours. You know, we hear all the time in the media about the problems, and they're very real problems, of, endless waiting lists and how much care has been derailed by COVID. We hear about ambulance delays, and I'm not minimising these problems, they're very serious. But I think what we all have to understand is that, working behind the scenes, the system, and that includes the NHS and social care and voluntary services, people like Health Watch, are all working together to speed up, to make more efficient, to make more effective, to make more patient-centric the services that are delivered to our population. And what's important at this moment in time, when there is considerable change, is as a community ambassador, you can make absolutely certain that the voice of the people who matter most, and that's patients, are at the heart of these decisions.